As you're saying, Boris Johnson was trying to win over support for the lockdown in England with some stark warnings, but also with what he hopes are some cheering prospects. He talked about the prospects for a vaccine. He talked about tests which would be virtually instant soon. And he talked about technology allowing the country to overcome the virus by the spring. I couldn't find a Conservative MP who, in their heart of hearts, truly believed any of that. There is enormous disquiet, anger in some quarters amongst Tory MPs about what they're being asked to back and the fact that policy has switched so quickly. I'm not convinced that's going to feed into a really massive rebellion when MPs get to vote on this on Wednesday. But it's coming anyway for England because Labour have said they're backing it come what may. There was extra money as well for the self-employed to help them through the month, and also a promise that the furlough scheme would apply to Scotland if there were to be certain occupations requiring it there, and that obviously needs new money as well. The money pouring out of the Treasury at the moment, it seems at quite a rate. Here's how the week of the new English lockdown began.
I just want to say that the Prime Minister will be offering remarks to the CBI later this week.
The Prime Minister couldn't make the booked slot addressing the CBI annual conference. He was busy trying to stem a revolt in his own party against the national lockdown that starts on Thursday.
There is no alternative but to take further action at a national level. And to those in this House who believe we should resist further national measures, let me spell out the medical and moral disaster we face.
He warned without a national lockdown, the NHS could be overwhelmed, having to send away COVID and non-COVID patients. From Thursday, most socialising must end, and most of the hospitality industry must shut down again.
Speaker, I am truly sorry for the anguish these measures will impose, particularly for businesses which have just got back on their feet.
So what I've got here is I've probably got about 100 casks, sales value around about £10,000. So unless I sell these by Thursday, which is not going to be possible, this is beer down the drain.
This brewery is in Harrogate, a town that finds itself catapulted from Tier 1, the lightest restrictions, to full lockdown on Thursday.
It's the right thing to do. You know, the numbers are just driving up, aren't they?
To be honest, no, because I think after this month lockdown again, it'll just the infection rate will just increase all over again, and we'll have to do it maybe a third time or a fourth time.
Officially, Harrogate and the rest of England emerged from lockdown on December the 2nd. Boris Johnson told his own sceptical MPs that really might happen on time.
It is only 28 days, Mr. Speaker, and the hope I can offer, the candle in the darkness, is that we will, if we get this right, be able to go back to something much more like normal life before Christmas, and people will be able to celebrate Christmas in churches and elsewhere across this country.
Do you trust the government not to renew this lockdown at the beginning of December?
Well, no, because they've already started to indicate that there will be circumstances in which they might well roll it forward.
And you think it's pretty likely right now?
Well, unless the situation changes dramatically.
The run-up to Christmas parties, inside houses, inside pubs, you can see how they could mount the case not to
I can see it. It fills me with foreboding and despair.
At every stage, he's overpromised and underdelivered. Rejecting the advice of his own scientists for 40 days was a catastrophic failure of leadership and of judgment.
It's only a few days since Boris Johnson was singing his critics' tune, defending his regional tier approach as he attacked Labour's lockdown policy.
He wants to plunge the whole country, back into a damaging lockdown. He wants to turn the lights out.
I'm afraid that we established a position, and we came off that position within 3 weeks of establishing it. People now are out, they can rationalise risk. They understand the risks to themselves, and people are going about their normal daily business as best as they can. Then all of a sudden, at 1 minute past midnight on Thursday, the rug is going to be pulled out from underneath them. I believe the government has made a very, very grave mistake.
We are massively increasing help for the self-employed.
There was a doubling of the original package of help for the self-employed. Economic support policy changing fast and frequently as overall COVID policy does the same.
Here we are with tier system 1 minute, lockdown the next, and I just think they've lost the plot a little bit right now. That leaves us in limbo land. The customers, therefore, have got no confidence to book, and those that have booked want their money back.
Can the Prime Minister tell me what we did not do in June and July, when rates were right down after lockdown number 1, that we should have done?
Where I think we should have pushed harder was on actually insisting that when people were contacted, they isolated. And it doesn't look to me as though the numbers, the proportions have been good enough. We need to get those up in the next phase.
A steady but massive expansion of testing was at the heart of the Prime Minister's promise that COVID could be defeated and lockdowns not continue forever. MPs vote on the new measures on Wednesday.
Gary Gibbon reporting there. And the latest government figures show that there were 18,950 new cases recorded in the last 24 hours. 136 people have died, bringing the total number of deaths with coronavirus in the UK to 46,853. And tonight, the North West Ambulance Service has declared a major incident due to a high level of calls, further underlining the pressures in the system. Well, earlier I spoke to the National Medical Director of NHS England, Professor Stephen Powis, and I asked how much strain the health service was under.
We are seeing pressure on NHS hospitals at the moment, and of course that pressure is occurring predominantly in those parts of the country where infection rates have been highest in the community. So that's parts of the North West, around Liverpool, Merseyside, Greater Manchester, parts of Yorkshire and Humber as well. But we're now seeing infection rates rise in the south of the country as well. And unfortunately, that inevitably means that, left unchecked, there will be pressure on hospitals in those areas. And of course, unfortunately, more deaths.
Are there currently hospitals in England that are full, though?
Well, there are hospitals where very many of the patients who are being treated have COVID. So, for instance, in parts of the North West, some hospitals have up to around 30% of their patients with COVID. Now,
but does that mean you'd have to turn people away?
Well, they are of course, seeing patients without COVID at the same time. And of course, one of the differences this time round, compared to the spring, is that we are still seeing people who need elective care, elective operations and procedures.
As the weeks go on, might you have to reconsider treating non-COVID patients, postponing those operations?
We don't want to get into a position where we have to step down care for non-COVID patients. The way to avoid that is to reduce infection rates in the community, for the public to do what they did in the spring and to comply with the restrictions that have been put in place.
The NHS boss, Simon Stevens, was reportedly uneasy about the slogan "Protect the NHS" because it deterred people from coming forward for other complaints. How uncomfortable are you with that slogan being used once again?
Well, we want the British public to comply with the measures in place, but of course it's the job of the NHS to protect the public. We want to make sure that everybody lives as healthy life as possible, that we're there to treat illness and we're there to do our very best. That's what our staff get out of bed for every day.
What do you say to people, MPs among them, who oppose this second lockdown? They point out that the average age of people dying with COVID is 82.
We do see more admissions to hospital in older people, but that doesn't mean we don't see younger people tragically coming in and dying with COVID too. We also know increasingly that there are long-term effects of COVID. I have been talking to many people, young and old, who are now suffering from those long-term complications.
The Prime Minister is promising that lockdown will only last a month. Speaking purely from a medical point of view and looking at the figures that you're seeing coming through, might it have to go on longer?
Well, that's a question for politicians. What's important for the NHS and NHS staff is that we see infection rates falling. We have begun to see the rates slowing in areas of the country where measures have been put in place in the last few weeks, but frankly we need to drive down infections.
Stephen Powis, thanks very much.
Thank you.